Good evening, everyone, and welcome. Great to see everybody again this evening. Welcome to another 6 o'clock live. So it's great to see everybody. And again, for those of you that catch these on the replay, thank you so much. As always, it's great to have the opportunity to share information with you. For those of you that are meeting me for the first time, my name is Laura Betts, HyperbaricsRx. I am founder and facility director. I got a bunch of other letters at the end of my name, and let's get into tonight's topic. So again, welcome. So tonight I want to talk about a common question that we get, especially down here in South Florida. We tend to have a little bit older population. And a common question, can you do hyperbaric oxygen therapy with a pacemaker? And I'll talk a little bit about some of the concerns that go along with that and give you a little bit of education to help you determine candidacy. So whether you're a physician that's listening to this, interested in the hyperbaric for the first time, whether you are an end user that is considering hyperbaric for yourself, again, welcome. And of course, hello, fellow ANDI Hyperbaric facilities. I know many of you use the videos to do patient education at your sites. HyperbaricsRx is an ANDI Certified Hyperbaric facility. So again, welcome. Last week, I did a topic on mold exposure, really commonly overlooked root cause. And very often when there is a mold component, it takes a chronic case and adds a whole other layer, a whole additional challenge to handling that mold, handling that mycotoxin. And we've been working with mold cases for many years. If you've had mold exposure, please reach out to us. The mold can be properly detoxed. There are labs that can be run to determine what your actual mycotoxin levels are. We also use a really neat tool called quantum nutrition testing that can give us some information that can help us zero in on the right direction. So again, if you haven't checked that out, that is under our videos. And again, we do these every Monday at 6 o'clock. And we have a large library of past topics. And again, this is to give you information to help continue moving forward in your health naturally. So again, as always, it is great to share information. Again, I'm founder and facility director of HyperbaricsRx down here in Fort Lauderdale, Florida. And yes, if you're looking to do hyperbaric oxygen therapy, our chambers are here at the clinic in Fort Lauderdale. However, we do telehealth all over the world, and please reach out to us for a comprehensive consult. If you've been struggling, we can help. I am a longtime member of the ANDI Diving and Hyperbaric Medical Board. I am also Vice President of Substance Abuse Program and Protocol Integration for the International Hyperbaric Medical Foundation. And again, sometimes with some of the research cases, some of the specialty cases, they've been through a bit of it. They're very challenged. And tonight's topic is a good example of something that comes up, which is, again, talking about a pacemaker. So again, let me go ahead and get into the topic for tonight. Now, by the way, just as a reminder, Facebook only holds 30 days of our videos. So if you're looking for some of our older videos, if you're looking for where they're archived, they are on our YouTube channel. So you can go ahead and check that out. So again, so let's talk now a little bit about pacemakers in general. Now, hyperbaric tends to be highly indicated, meaning it's good for cardiac applications. There's a lot of research on hyperbaric for cardiac inflammation like myocarditis. Hyperbaric is a super powerful anti-inflammatory. I've done a video prior talking about how HBOT helps inflammation. And of course, in the case of any type of inflammation, the oxygen is going to go just about everywhere in the body. And we may be doing hyperbaric for one reason, but we're getting a full body anti-inflammatory effect. Now, you have to be pretty unhealthy to not be healthy enough to lay there and breathe. Hyperbaric is very well tolerated. We have worked with very, very young children younger than a year. And we've worked with geriatric clients. I think our oldest is 98. because it's non-invasive, right? So like a needle pierces the skin. Something extreme like being intubated, they put a tube down your throat. Those are pretty invasive things. Hyperbaric is non-invasive. We're not inserting anything. There are no pricks, there are no cuts, there are no pokes, there are no stabs. Again, you have to be pretty unhealthy to not be healthy enough to lay there and breathe. And in the world of contraindications, meaning a reason why somebody wouldn't be able to do hyperbaric oxygen therapy, there are very few of them. Respiratory health is an example of one of them. So you need to be in some reasonable level of respiratory health. But again, even in cases of people with pulmonary conditions, there are hyperbaric protocols that may be appropriate. There are even protocols, for example, for like COPD, which is an obstructive pulmonary disease. In that scenario, there are even research on how people benefit from hyperbaric. And I would argue that once the respiratory system becomes compromised, how do we properly transport oxygen? How do we effectively get oxygen to the area? I would argue that they need hyperbaric more than ever. And there's a very, very narrow window for them to get improvement before the lack of oxygen compromises the healing mechanism. So again, now pacemakers themselves, pacemakers are what's referred to as an implanted medical device, right? So a pacemaker is designed to essentially, they operate in both ways. They can be used for inconsistencies where the heart is not beating normally. They can be used because there was some kind of cardiac event. Essentially, the pacemaker is a device that's helping the cardiac function, that's helping the heartbeat. It's playing a role. And for the most part, pacemakers are not contraindicative. So can you do HBOT with a pacemaker? And the simple answer is probably. And the reason why I say probably is it depends on the brand of the pacemaker. So here at HyperbaricsRx, when we're receiving a referral and the referral happens to have a pacemaker, which comes up usually beforehand, but definitely by the time we take their medical history, we need to find out the make and model of the pacemaker. And in most cases, the pacemakers, it is listed as to whether or not the pacemaker is approved, and most pacemakers are approved. And then there is a pressure rating that goes along with the pacemakers, and not all pacemakers have the same pressure rating. I'll tell you something else that's very interesting. The newer pacemakers, many of them have lower pressure ratings than the prior counterparts. And I find that interesting because you would think the technology would improve. You would think the technology would be able to handle pressure better. And based on the information, the newer pacemakers, in some cases, are not cleared for as high a pressure, as deep a depth as prior models that we've seen. So that's interesting. I wonder why. Some of it may be a knee-jerk liability reaction, not really sure. But whatever the manufacturer is saying, this letter, in many cases, if you just look up the device, it actually lists it on the manufacturer's website. And you can, there's a link there where it talks about it. Some of them, when you're reading the device, it says cleared for hyperbaric oxygen therapy for pressures up to 2 ATA, which is about 15 PSI working pressure. For those of you that are listening to another country, your 2 bar is your pressure rating there. So again, the simple answer is, in general, just because we have a pacemaker doesn't mean we can't do HBOT, but we do need to check the make and model of the pacemaker. Now, again, people with pacemakers, they fly in airplanes, they go in elevators, they go up and down hilly areas, they go up and down mountain ranges. So again, the pacemaker needed to have been designed to handle a certain amount of pressure. We do deal with pressure changes. We do deal with variations in pressure as a consequence of just day-to-day life. And some of you, if you've ever gone in an elevator in a skyscraper in a really tall building, you may notice that your ears pop. And again, that's because there is a pressure difference. So again, in most cases, they're rated for pressure, but we need to look and see exactly. And then depending on what that pressure is, that max pressure is going to be our maximum dosage, even if it's more appropriate for them to dive at another dosage. The pacemaker becomes the limiting factor, and we are not able to exceed that working pressure. Now, if you have been turned away for hyperbaric oxygen therapy because you have a pacemaker, please reach out to our facility for a second clearance. Let us know the make and model of your pacemaker, and we will look on the manufacturer's website and see what the device rating is. Again, in a lot of cases with hyperbaric oxygen therapy, they don't have all of the information, so they're going to err on the side of caution. And sometimes in erring on the side of caution, they're excluding someone who would be an optimal candidate for HBOT simply because they don't have all of the information, because they're not an ANDI Certified Hyperbaric facility, because they may not have training in hyperbaric medicine, they may not have experience working with these various considerations that go along with it. So if you've been disappointed, feeling that, wow, I really thought this was going to be able to help me, it may be possible. Most of them are cleared for some pressure rating, and most of them do have specific clearances for hyperbaric oxygen therapy. Again, it is a cleared indication, though there's only about 13 things that insurance in the United States covers, and it's got a pretty strict billing criteria. It is still something that is regarded as a potential therapy. And again, people need to be able to go in elevators, they need to be able to fly in airplanes, so they've taken that into consideration. The same is true, by the way, with many other different types of implanted medical devices. So baclofen pumps, pain pumps, some of these devices are cleared for HBOT. They are rated for HBOT. Now, some of them aren't. So again, this is part of making sure that we've got a complete medical history and that we're making informed decisions and that we are checking with the manufacturer of the medical device in order to see what it's been tested and cleared for. So I hope that give you a little insight into this. And this is just one of the many examples of all of the information that we have here at HyperbaricsRx. We are one of South Florida's oldest hyperbaric facilities, and we are the first and only hyperbaric center of its kind. We are using a unique combination of modalities, natural health modalities, and these create an optimal opportunity for efficacy, free from negative side effects. We get people in our clinic all the time that have done hyperbaric oxygen therapy and don't have a good story to tell. They didn't get results from it. They didn't see the benefit that they were expecting. And I will tell you, very often there are reasons why. Hyperbaric is trendy. Everybody wants to get into hyperbaric, and a majority of people offering hyperbaric, they're learning on their patient's dime. They are new to hyperbaric. In a lot of cases, they are untrained, uncertified. They're not ANDI sites. And the good news is that it's very hard to hurt somebody with a hyperbaric chamber. And as a result of that, we've got 2 decades of very little reactivity to enforcement. But the modality is growing faster than access and education. And unfortunately, the industry is earning a lousy reputation, and it's working very hard to do that. So again, another reason why you want to be diving at our facility, another reason why you want to be diving at an ANDI certified hyperbaric facility like ours. If I haven't mentioned, we are also a training and a research site. So we have people come from all over the world to become certified chamber operators, to get practical hands-on experience in a real-time clinic. For those of you that are coming out to do some of our internships, welcome, welcome. I look forward to seeing each of you there. And HyperbaricsRx is also one of the ANDI research sites. So a big reason why you want to come to an ANDI certified hyperbaric facility, in addition to the training, in addition to the safety, is ANDI hyperbaric facilities have protocols. And some of this comes from the experience of the agency. Some of this becomes from the work that the research sites are doing. I've talked a little bit about that. I should probably do a video on it specifically. But when we're talking about hyperbaric protocols, I've done videos earlier where I'm talking about how important the dosage is. And if the dosage is not appropriate, we may not even be creating the opportunity for efficacy. The reason why we didn't see any symptom resolution is because we weren't turning on the right switches or turning off the right switches, depending on the dosage protocols. So it's been an ongoing privilege to be part of one of the ANDI research sites where we are able to investigate into these various responses and ultimately determine protocols that work. And it's a big difference in the ANDI organization. And we're also an international organization. Keep in mind, in different countries around the world, hyperbaric is used very differently. In some countries, there are many more indications than are cleared here in the US. And in other countries, there are actually less. So big differences all the way around. Again, as a reminder, you can find the archive of our videos on our YouTube channel. If you haven't had an opportunity to like and subscribe, we really do appreciate that. And then again, we are an ANDI certified hyperbaric facility. We offer personalized dive plans. So if you are struggling, if you are looking for some help, if you are dealing with symptoms, if this is just your normal headache and your normal ache and pain and your normal projectile vomiting, this is just, we had a case come in, this was just their normal explosive diarrhea. Well, your symptoms are an indication that there are things that are wrong. There are root causes that need to be addressed. Your body does things for a reason. So whether it's runny nose, whether it's an ache and pain, or whether it's something more serious like a immune disorder diagnosis, please reach out to us. We would be happy to help you move forward and make progress in your health. We offer discount dive packages. We offer personalized wellness programs. And again, I want to emphasize that what we do is personalized. There is no two human beings that are exactly the same. There are no two human beings that have the exact same experiences. Even in the case of twins, where you would have the exact same DNA, they've had different emotional experiences, different environmental experiences. We are all unique. And because of that, we all need a unique approach. While I love the idea of writing a supplement schedule that applies to everybody, that's just not the way it works. The body heals in layers. As organs come back into balance, we get new projects that present themselves. We live in a really toxic world. We get exposure all the time, so we can be moving forward in our health, doing great, and then we can end up with some kind of toxicity. For example, I just had a client, they went and played golf, and they hadn't played golf in a long time. And the lovely golf course that they were playing on was covered in pesticides. And they're neurologically sensitive. They have blood-brain barrier damage from their prior condition. And those pesticides really affected them. And we needed to make some adjustments in their personalized program in order to handle that new exposure. And again, everybody's different. We need a personalized program, and that's exactly what we do here. So we do programs to naturally support and rebalance the body. Again, whether you're listening to this from somewhere in South Florida or anywhere in the world, we literally do telehealth. We help people all over the world rebalance their health naturally, and we'd love to help you. So please reach out to us. Our number is 954-749-9998. Send us a message. Stop struggling. Stop normalizing things that aren't normal. No, it's not in your head. We really can help. So again, I hope you enjoyed this topic this evening. Hope gave you a little bit of education on implanted medical devices and pacemakers. Again, my name is Laura Betts. Hyperbarics is my facility. Some of you know me as the Oxygen Lady, and I look forward to seeing each and every one of you at 6 o'clock next week. Again, we do these every Monday. So thank you, and safe and happy diving. Have a great night.